Hello, my name is Jessica Holman, and I did my research project on mast cell tumors. I'm going to share my screen in just a second and open up my Zoom and PowerPoint application. All right, so mast cell tumors are a type of round cell tumor. They participate in allergic and inflammatory responses and contain granules. The granules consist of histamine, heparin, and other cytokines on activation of cells. This is otherwise known as degranulation. Like the image I added from our veterinary hematology book, the granules can obscure the nucleus and can range from fine to coarse. Move to the next slide. Although the etiology is not fully known, there are a few factors that come into play. In dogs, it is the most common neoplasm and originates in the bone marrow. Boxers are the poster child for predisposed breeds, but other popular breeds can include Labrador retrievers, golden retrievers, and pugs. Upon research, I found other predisposed breeds, but those were the most common. This could be due to a possible mutation of the proto-oncogene gene called c-KIT. Research also stated that at times it may not be breed-specific either. Cats rarely play a role in mast cell tumors, but Siamese cats tend to be a predisposed breed. Okay, cytokines can be one of the main causes of clinical signs. These tumors can increase or decrease in size day to day and vary in location, appearance, and shape. This is because of the breed or reactions occurring in the mass due to release of the histamine from swelling. The tumors occur in the skin and cutaneous sites and can metastasize to regional lymph nodes, the spleen, liver, or bone marrow. Physical findings are sometimes pruritic and may or may not be red, hairless, soft, firm, ulcerated, or swollen. They can also be mistaken for an abscess, skin tag, insect bites, lipomas, or another type of tumor. So it's always best to obtain a sample by using a fine needle aspirate and cytologically stain. This is one way to diagnose, as well as immunohistochemistry. The top right image was taken by me, actually, through the microscope, so it's a little bit blurry, but it was from a shelter dog while Dr. Santonzi and Dr. Sang performed a neuter at school in our lab class. So caudal to the dog's scrotum, there was a mass that I collected a sample from using a non-aspirated technique and a 20 gauge needle. I then attached the needle to a 3 ml syringe to expel the material onto a slide, and then used a slide over slide smear or a squash prep technique before staining it with Diff Quick. I actually still have the slide right here. Can probably barely see it, but here it is. So you can see in the bottom picture that I put to use for comparison. I pulled this picture from our Cowell cytology book. You can see that the right stain picks up the granules much better than the Diff Quick. Diff Quick is the stain of choice in clinics. However, Wright's is the stain that's used at universities and commercial clinical pathology labs because it's more sensitive to detect intracytoplasmic granules that stain blue and purple. Okay, next slide. All right, the #1 treatment of choice is surgical excision. For most mast cell tumors, the excision should have 2 centimeters or greater lateral margins, and 1 fascial plane deep of the tumor. The biopsy sample should be then fixed in 10% neutral buffered formalin with a 10-to-1 ratio and sent to a histopathologist to confirm diagnosis, prognosis, and the grade of the tumor. There's a few different systems that are used for grading. One of them is the Patnick system, which is most widely used and divides the tumor into 3 categories based on their histologic appearance and invasiveness, and it uses Roman numerals. For example, a poorly differentiated mast cell tumor containing few granules would be a grade 3, compared to a large, well-differentiated granules, which would be grade 1. There's also the Kupel system that uses a simpler approach by separating the tumor in low grades and high grades. Besides surgical excision, depending on the grade and prognosis, there's radiation therapy, chemotherapy, or a combination of the 2 or the 3. Okay, and here is the citations for the images I used on my slides. And that includes my PowerPoint presentation on canine mast cell tumors. Thank you.